So today, our theme is civic engagement. This is something also known as civic participation or active citizenship. And this phrase basically applies to any individual or group work you do as part of a community in order to make a change or make some sort of difference. A lot of times this term is interpreted politically, like when you participate in voting or supporting someone's campaign or even running for office, but it also applies to other aspects of what makes up a community, like economic participation, community service, and public health.
So for this specific session that we're having today, this is our third session, as we mentioned previously, I believe so. Miriam said that. We want to highlight why do we care to talk, like why we care talking about this. So we can say that current events have shown that caring about our community is as important as caring about ourselves. And sometimes holding yourself accountable has a positive impact on your community as well, such as, I don't know, like try to get vaccinated as soon as vaccines are available for you, or wearing a mask, or vote, and, you know, have community involvement for whatever reason you want to be involved with your community. And also a little bit more why we are currently holding this session tonight, or afternoon. So it's to encourage dialogue about what it means to be an active citizen, and to use this knowledge as a tool to improve your status as a citizen, which in other word actually means to be a member of your community.
So what you're seeing here is something called the active citizenship continuum. It's a scale of your involvement or your engagement in your community. So if you see there on the left, your first tier is being a member. A member is someone who's either unaware of or unwilling to learn about community issues and therefore doesn't intentionally seek out ways they can give back. A step up from a member is a volunteer. This is someone who does community service, maybe votes in elections, so on and so forth, but their knowledge of the implications of their actions is limited. After that, one becomes a conscientious citizen. This is someone who not only volunteers and does these concrete actions, but also begins to wonder about the bigger picture. They ask themselves if the problems they're working to solve are systemic, and they wonder what they personally could do to combat certain issues. Finally, the highest tier is being an active citizen. This is someone who makes the well-being of their community a top priority in their life and actively seeks out ways to solve these root problems that they learned about while they were a conscientious citizen, or that they will continue to learn about on their journey to active citizenship. So as we go through our program this evening, we hope you guys will keep these 4 levels, like these 4 tiers in mind, and try to pinpoint where you think you stand or where you'd like to stand eventually on this scale.
So our first guest this evening is Mr. John Scianimanico. John grew up in LaGrangeville, New York. It's about 30 minutes away from Mariapolis, Luminosa. He's currently working with the Connecticut Governor Office, helping the state navigate COVID-19 pandemic. Ever since high school, John has been passionate about government and public service and has held a number of jobs that allow him to engage in both. He began his career as a high school math and statistics teacher with Teach for America in Huntsville, Alabama, where he developed a passion for economics and public policy. This experience led him to work in the White House Council of Economic Advisors in Washington, D.C., and at Arnold Ventures, a national philanthropy based in Houston, Texas. Recently, John also served as a regional organizing director in the Pete Buttigieg campaign in Northwest Iowa. He helped with that. And then John also graduated from American University with a bachelor's degree in political science and from the Harvard Kennedy School with a master's in public policy. Oh my goodness, this is just such a long list of accolades. John, how are you, man?
Good. Thank you very much, Chris. I appreciate the introduction and good job with pronouncing both my last name and Pete Buttigieg's last name. I think you did great.
Man, see, I had it on the tip of my tongue. Nice to meet you, John. You seem like a nice guy.
Thank you. Likewise, I'm really happy to be here with you guys tonight.
Yeah. Okay, so I'm gonna start off asking a question. So with all the diverse presidential candidates this year, why do you choose to run Pete Buttigieg's campaign, and do you recommend following like a specific process when someone's choosing to support a certain political figure? Like, how does that go?
Sure. So I think, as I'm sure everyone on this call knows, starting in 2019, the election for 2020 really started picking up, and there were, I think, about 25 different inspiring candidates on the Democratic side who were tossing their hat into the race to win the nomination. Of course, the Republican side was pretty much teed up with Donald Trump running for re-election. But on the Democratic side, there were a lot of people running to win that nomination. And at first, I wasn't considering who I would work for. I was just looking for a candidate who I could support either by volunteering or donating time or money or talking about them with friends. But Pete really stood out. Pete Buttigieg really stood out early on because his whole campaign was just centered on values of freedom, security, and democracy that really appealed to me in a way that I had never heard someone talk about those values before. For example, he talked about freedom in a way that isn't freedom from something, as we might have heard in school growing up, like freedom from oppressive government, freedom from tyranny, but freedom to pursue things in life that are important to us. And so he redefined what freedom could mean for us as Americans, and I thought it was a really interesting way to talk about it. And so that drew me in. And then I just got to know him better. I liked his military service and that he had a big plan for national service. I liked his youth and that he was of the millennial generation. And just his positive demeanor and not someone who drew sharp lines in the sand and had this either you're with me or against me attitude.
Right.
I think he was someone who could, really bring in a whole swath of people and unite the country. And so I guess, Chris, for those reasons, his campaign attracted me so much that I wanted to be more than just a volunteer. I actually wanted to work on it, and was able to go to Iowa for about 6 months, worked in the northwest corner of the state, did a lot of knocking on doors, did a lot of talking to undecided voters, convincing them to vote for or to caucus for Pete, because in Iowa they have a caucus system, which I can get to later if there's questions around that. But to the second part of your question in terms of a process, I think there's different ways that you can learn about a candidate. One is figuring out what's important to you, right, and seeing how where you stand on issues aligns with where they stand on issues. And the easiest way to do that is by going on their website and looking them up. I think debates are a really great way, especially at the presidential level. Televised debates you can see a candidate under pressure. You can see how they, what their vision is, really figure out why they're running for president. A lot of candidates don't do a good job, even though it sounds like an easy thing to do. A lot of them don't do a good job of explaining why they're running for president. So you get to pay attention to that. And then town halls in Iowa. Town halls are practically every day during campaign season. Of course, they were in person then. Now they're virtual, but it's very common for people to go hear from the candidate directly, and that it can be at any level, really. It can be for mayor, it can be for a state representative, it can be for a congressional representative, where you can go directly see them in person, shake their hand, and hear why they're running for their office, as opposed to through the filter of the news media, which tends to skew, I think. So those are just some clear steps I would recommend for people who are trying to figure out, what candidate out there is the right one for me to be able to support.
Yeah.
Yes, Chris?
Oh, Chris, I think I lost you on my end.
Are you okay, Chris?
He might be having trouble with his video and also with his audio. So I'll just ask the second question. Okay, and that question is, a lot of times, especially in the past year, we've heard a lot of people say that they won't vote because they don't like either candidate or because they don't feel they make a difference. how do you restore faith in the political system today?
Yeah, yeah. Thanks, Mike. That's a great question. You know, when it comes to voting, the United States is really, really far behind other wealthy, developed first world countries. Just if you look at our voter participation rates, that is the number of people who are eligible to vote, and that actually do vote versus countries in Western Europe, Japan, Australia, etc. We're just like way behind these other countries, and there are many reasons for that. One, it might be voter apathy, as you described in the question. When people say to me that they don't feel like voting matters, or that the person in office doesn't matter, even like it doesn't matter if it's a Democrat or a Republican, I really try to understand why they feel that way. Because my sense is that unless you're living in the middle of nowhere, or you're growing your own food, or you're not utilizing public education or healthcare services or public safety, your life in some way or the other is impacted by the people who are in elected office. And so when people say it doesn't matter, I really try to understand where they're coming from, and then probe them to think a little bit harder, because sometimes we don't realize it, that it does make a difference. I mean, just look back at the past 4 years, and whether you think we're in a better position now or in a worse position, so much has changed in our country, and so much change can be attributed to the Trump administration and the people that we elected to serve in Congress, right? But that said, I think there are a number of things that we can do to get more people excited about and enthusiastic about voting. The first is we can encourage more young people to run for office, getting new blood, people with no political background, new ideas, change the way that our politics is run and get people excited about going to the polls. I mean, it's really what got me excited about Mayor Pete was that he was a young guy, he was a millennial, and it activated me to be more than just a volunteer, right? But to take that next step or be on that next level as the structure that you guys laid out earlier. Another way that I think we can incentivize voting in a more structural way is by reforming what's known as the Electoral College, which I'm sure everyone on this call knows. I'm not going to go into detail, but I think a lot of people in states like New York and California and Texas don't vote because the state every 4 years in the presidential election always goes one way, right? It always goes Democratic in the case of New York and California, or it always goes red in the case of Texas. And so I think a lot of people think, well, what's the point in voting for the presidential election if my state is basically, the conclusion is foregone, right? Mm-hmm. My thinking is that what if we abandon the Electoral College, and if we chose the winner of our presidential elections based on the simple premise of one person, one vote, like we do in every other election, right? Where my vote in New York mattered equally to a Republican in New York, and in Texas, a Democratic voter's vote mattered equally as a Republican voter's vote. Would that then make people feel like their vote mattered more, and then it carried more weight? I think it would. And then finally, I think we can share our stories more often with friends and family who don't vote or don't see why it's important. Because even if they don't think it's important for them, even if there aren't issues that matter for them, even if they don't think their vote matters, or the person in office matters, if it does for you and they see how putting that person in office will matter to someone who's close to them, that can be a powerful motivating factor to go to the polls, right? They're voting not out of their own self-interest, but they're voting out of the self-interest of someone that they're close with.
Right.
So that would be a third way that I would think about of encouraging people to go to the polls, especially people that we know well.
Right. Well, hey, I'm sorry to cut out there for a second. I'm telling you, I don't know what's going on here, but you're making some really good points. I agree with a lot of what you're saying. I wanted to just, because I got cut out just before the end of the first question, I was going to say like how interesting it is that, like what you were saying in Iowa, you can go and meet your representatives and stuff like in person. Like you don't meet Greg Abbott, or Cuomo. Like that doesn't happen very often. You can't just go to a town hall and meet them. It should happen more though, right?
Yeah, I mean, I think, Iowa is really a special place in our current system. Who knows if it will continue to be, but because it's the first state that nominates delegates for both the Democrats and the Republicans, all the candidates are spending 75% of their time there, and they're
Right.
doing real like retail politics, right? Like
Right.
going to these
Boots on the
small
ground.
towns where,
Yeah.
right, exactly.
That's super interesting. Yeah, because it's totally foreign to me. I don't think I've ever met one representative for Texas ever in my life, except for maybe a judge. I don't know. Okay. Well, thanks, John. I got one more question for you. So the primary goal of this workshop is to learn how to become more active citizens, like in order to make a positive change in each one of our respective communities. So, like, in your opinion, what are some of the first steps our generation can take to achieve that goal, or to move that goal forward? Like, how can we do that? Like, in your opinion?
Yeah. Well, I think there's a lot of different steps that we can take, especially for people who maybe checked the box on the survey, like I'm not involved, or maybe I'm involved, but I'm not really sure. There's a lot of like easy baby steps that we can take if we want to be able to check that as a yes box, right?
Yeah.
And I'll just give some ways that come to mind. One is, reading just local and national newspapers, right? So I have a subscription to New York Times. Sometimes my previous jobs, my work is actually paid for it, which is great. But I use it just to keep abreast of what's going on, knowing what the big pieces of legislation are in the works and how they can impact your pocketbook or your healthcare or your college debt. I think second, figuring out who your congressional rep is or your state rep is, right? And maybe following them on social media, following how they're going to be voting on certain pieces of legislation, especially the ones that are getting a lot of media attention.
Right.
And I work in Connecticut, and so I'm exposed to the state legislatures. Whenever they vote on a bill, they invite members of the public to submit testimony, and that can be a written piece of testimony saying, I support this bill because XYZ, I oppose this bill XYZ. And then you can even speak in front of the legislators and express why you think they should support or oppose the bill. And sometimes they'll ask questions, and they love getting testimony from young people, especially when the issues are related to higher education, when they're related to K-12 education, right? These issues that are affecting our generation most significantly.
Yeah.
And so look out for ways that you can submit testimony if you want and have your voice heard. And then, if you want to take it like a step up, like volunteering on campaigns can be a lot of fun. They're a lot of work, but knocking on doors, making phone calls, organizing house meetings or house parties with your friends, where they can learn about the candidate. Those are all great ways just to kind of build community and kind of engage in the political process. And then probably the last idea I have, which is the easiest but the most impactful, is just to vote on election day. Vote early, vote by mail if your state allows it. Cast that ballot and make sure that you have your voice heard in the political process is probably the most important thing that you can do.
Right. Well, that's a good point, John. I really like that answer. It's a good stuff, man. We really appreciate you being here. Thank you so much for the interview and staying cool with me while I got cut out.
Oh, yeah, of course. Thanks, guys.
Yeah, thank you. Dude, if we could make a giant applause, I'd say, can we get a round of applause for Mr. Scianimanico? Because he just murdered that interview. That was fantastic. All right, John. Thanks, buddy. Okay, so we're moving on. Dr. Quyen, no Metzger. This is our next speaker. Dr. Quyen is a professor in the Health System Science Department. She teaches and mentors students and junior faculty in prevention, population health, health disparities, and evidence-based medicine. Prior to joining the Kaiser Permanente Bernard J. Tyson School of Medicine, she was a scientific director of the U.S. Preventative Services Task Force, which has developed and maintained over 130 clinical practice guidelines for preventative services. Dr. Quyen brings over 2 decades of experience studying and improving quality of care. Her research focuses on prevention, the social and cultural determinants of health, implementation science, healthcare systems, and evidence-based practice. She's also published more than 85 original peer-reviewed articles and received numerous awards in recognition of her work. Wow, amazing. Hello, Dr. Metzger, how are you?
Good. Hi, Chris. Hello, everyone.
Listen, you know, hey, I'm not trying to shoot you down, John, but she's got a pretty good list of accolades here too. Like, this is crazy. You guys are some really well-achieved people. Thank you so much for doing what you've done. It seems like there's a lot of work and a lot of like drive that goes into this. So thanks a lot for that. So Dr. Metzger, I got one question to start off with. So like when people hear the phrase civic engagement, a lot of people think about voting or maybe paying taxes or something to that effect. Health is often seen as a completely like private arena. Like no one really talks about that as much. So like, how can we better understand that public health is an aspect of civic engagement that is just as important as political or economic engagement, like just as important as taxes or voting?
Yeah, so thanks for the question. And I'm going to talk a little bit today about health. And I think that just before I start, I just wanted to say a disclaimer that anything I say is my own opinion and does not represent the School of Medicine. And I have no financial conflicts. So I just want to say that if I'd like to just start out that there's 5 things that I just want each person to think about. And then you can think about how it relates to health and which one you're most interested in. So it's not on the slide here, but think about green space and think about like parks, recreation, bike trails. If you're interested in that, that's public health. Think about the environment, think about clean air, clean water, transportation, that's public health. Think about access to good nutrition and fruit and vegetables, not just fast food, but people having good food and having food security rather than going hungry, that's public health. Think about education. People cannot get educated, children cannot get educated if they're hungry, they can't pay attention in school. If they're hungry, children come to school without breakfast. Many of them don't have lunch or dinner, and they cannot be educated. So that's public health, even if you're interested in kids and their nutrition. And then finally, guns and violence, and that's public health as well. And we hear a lot lately, especially about these violence that has happened in our country, but most of the time, people with guns kill their own families and their own friends, their ex-wives, ex-girlfriends, in a moment of rage. And that's also public health. It's not just these gun laws or gun control, but most of the time when people have access to gun and they're angry or in fits of rage, it's really their own family members that the violence occurs. And we don't hear about that as much, but that's also public health. So those are like 5 areas that you may not think about when you think about public health, but if you're interested in any of those areas, they are very important areas to get engaged in. And as John said earlier, civic engagement is not just about voting, but about having an issue that you care about. So whether it's in the environment, whether it's about nature, parks, recreation, clean water, having clean swimming pool, clean area to swim in, or parks, or good nutrition or education, they're all really public health. So that's what I want you to think about. And I'm going to just have a couple very minor slides, but go through them quickly because I think people get confused. You're much more you're much more aware of what healthcare is, but not what public health is. So next slide, please. So healthcare delivery is usually what most people think about when they think about health. So, systems such as hospitals, clinics that deliver healthcare. But public health is really about the community and the environment that you live in, that we live in, and all of us live in most of our times. So we may end up going to the doctor like a couple of days out of the year, but the rest of the time we live in the environment, and that's community health and public health. Next slide. So again, just think of it as systems actually, and we actually, how do we play in part of the system? So next slide, yeah. So a lot of times you think about doctors and patients within a primary care clinic, in an exam room, in a hospital, in a larger, healthcare delivery system. There's often specialists, there's often urgent care, emergency room, then there's hospital labs. I mean, this is a very complicated system. Health IT, all of these are a very complicated system with different specialists. But most of the time we actually live out in the environment, within our families, within our larger community, within our network of social network and neighborhood, and within our local environment and our state and our regions. And then, we work and we go to school and we worship and we have different organizations that we volunteer in, and when we go to parks and recreation. And then, there's public services such as, trash or clean water, and there's policymakers. And all of this exists in a regional, local, state, and federal government. And really all these affect you locally, as much as anything, especially things like clean air, clean water, and the local, neighborhood and schools. All of that has to do with health. So next slide. Just skip on to the next one, I think. I just kind of want to just spend a couple minutes. I think you've heard, with the pandemic, a lot about Anthony Fauci, but I think locally, things happen a lot more locally. And I know at least here in Los Angeles, there's a Department of Public Health. That's a local county level. So usually there's a county Department of Public Health or a city, but usually in a county level. And they are the people who actually take care of records. Next. So they take care of the health of the whole population that lives in that county. So they get reports about disease incidents, when you're born, when you die, all of those kind of records at the hospital, the clinic goes to the public health department. They keep track of the records of death and births. And there's also the people they also keep track of the health of the environment. So if you think about it, if you go to a swimming pool that's a public pool, who keeps that clean? Restaurants, how do you know how your restaurants are clean? And then housing, you think about like lead poisoning in Flint, Michigan, or other areas where there's pollution, even places like massage, all of those things have to be, there's regulations and inspections and making sure that they're clean. And then there's also immunizations and screening and infectious disease, and we all know this because of COVID, the spread of infectious disease, that it's all community health. And then go next slide. Yep, so all of the public health provides all this information and then go to your policymakers. And I think this is where I think this talk goes back to what John's talk is, that you actually can influence the policymakers, because you as a member who lives in the community, basically whether you care about the environment, you care about clean air, you care about education, any of those things, your local representative and state representative make laws about all of these things. And they really do listen to you because again, you elect them. And so it's not just once, every 4 years or so, but they really do listen to you if they want to keep their job. And so I worked in the federal government for the past 10 years. And the single biggest thing I could say is you should always know who your local representative is in the state government and in the federal government, and talk to them, email them. I mean, they actually read your emails because the lobbyists and other advocacy groups email them. And so they really do read emails. Especially if you are calls, they actually do listen to you because you're the one who elect them. So I'll stop there, but just wanted to kind of explain to you what public health is and how you can be involved with your local public health department and then local representatives.
Awesome. Thank you, Dr. Quyen. Yeah, that was a lot of information. I hope everybody kind of was able to suck some of that in. It was really good stuff. I like the whole systems things and then like kind of how you see it. It's really, really interesting to me. So I got a couple more questions for you. So like a lot of people have been having a lot of talks about the vaccine, right? Especially lately. They don't really know if they should take it. I heard someone took it, they got sick, their arm hurt, someone's dying. So based off of like what like your own knowledge of evidence-based medicine, how would you respond to someone that's kind of like hesitant about taking it, or like how would you approach that?
This vaccine is 100% safe. Nobody has died at all. There's been millions of doses of this vaccine given around the world. This is probably the most tested vaccine we've ever had in the history of the world because it's been tested on millions of people around the world and nobody has died.
Right.
And so I think that unless you know that you're allergic to something in this vaccine, and even then, people who've had allergy, they've had their allergy treated. So nobody's actually been seriously ill from being allergic to this vaccine. So I would say it's 100% very safe. And it's actually what they give you is not anything having to do with the virus. It's a piece of protein that looks like that helps your body recognizes that when you actually get the real virus, your immune system is all revved up, ready to act. So basically the reaction that people get to their vaccine shot is your own immune system revving up. And when you have a fever or chills, it's the same thing that would happen if you had the common cold or a flu. That's your whole body making an immune response to a piece of protein that looks like the virus. So it's actually a good thing. So when I got my second shot, I was very sick for like 8 hours. And I thought, this is great. I'm actually developing an immune response.
Right.
Because when you feel like all the fever and chills, that's your own body like reacting against it. So that the next time when I actually see the real virus, I'm going to be all ready my body's like primed. So I would just say you should take it. The rest of the world wants it. And we're very fortunate to have it available to us here.
Absolutely. Yeah, I agree with you. So like, do you know a lot about the different versions? This is like a personal question because I know there's a Pfizer, a Moderna, a Johnson & Johnson. They're all pretty equally safe, right?
Yes, they're all equally safe. They've been tested very, very adequately with like millions of people around the world. So I would have no hesitancy with any of them.
Well, sign me up then. I'm ready to go. Let's do it. Shoot me up. Okay, Dr. Metzger, I got one last question for you. So it kind of goes like, how do you stay true to your values and how do you engage the advocacy groups?
I would say that find what issues you're most passionate about. I think I named quite a few, whether it's parks and recreation or the environment or education or food or guns. I mean, they all are our political issues because there's policy. And so having been in the government for 10 years, there's all kinds of laws that affect those things. And I think staying engaged is finding out more about things that you care about. And then, talking to your representatives because they're representing you in the government and stay active and engaged. But I think that the easiest way to do it is to stay engaged in a issue that you care about personally. Right.
Well, all right. I agree with you. Very good points. Thank you, Dr. Quyen. Thank you so much. That was a great interview. If anybody wants to just clap their hands she's done great. That was fantastic. Thank you, Mr. Scianimanico, Dr. Quyen. That was fantastic. I learned a lot. I don't know about everyone else, but it's great talking to you two. Very smart people, very well-educated people. Thank you. For taking the time.
Yeah, and Chris,
yeah,
if I can just say one thing, if anyone is interested in pursuing a career in government or in politics or just wants to learn more about the field in general, like how to volunteer on a campaign, I just dropped my email in the chat. And you guys are more than welcome to reach out to me, and I'm happy to help or provide any advice that you might have, if you have any other follow-up questions. I'm happy to be in touch.
Thanks a lot, John. Thank you, Dr. No. This was very great. It was awesome.